So this is for the interactive assignment. So it says mental health in the criminal justice system, and just some basic statistics about mental health as far as Americans and then offenders are concerned. It says that anyone can be prone to suffering with mental illness. Approximately 15% of Americans suffer from some mental illness disorder, and there are approximately 50% of inmates, inmates who are in like state prisons, federal prisons. Over 50% of them come in with some type of mental illness. Um, Mental illness affects everyone. Some causes of mental illness can simply be genetics. It can be hereditary. Environmental influences can, be a great cause of mental illness or can contribute to mental illness. Things such as issues in our economics, job loss, or divorce, or other stressors that can be related as far as our economic or our society is considered. What else? Social issues, personal issues, family issues. All of those things can contribute to mental illness. Things such as depression and bipolar disorder, anxiety, panic attacks, other types of forms of mental illness. So all of these can be symptoms and signs of mental illness: hereditary, environmental factors, social factors, personal, family-related issues. Let's see. And then 60% of the inmate population as well, before they enter into a prison setting, deal with some type of mental illness. 20% of them are more prone to violent offenses because of mental illness that has not been treated. So when we look at the study was conducted using Swedish participants, and so the method used was the qualitative method. And the qualitative method was used as far as it was just better as far as researching the participants, doing interviews and doing surveys. It allowed for more patient participation. Okay. Y'all kind of bear with me. I'm kind of nervous a little bit on here. And then just looking as far as what are some possible treatment plans for mental illness. Possible treatment plans could be drug treatment. It could be individual treatment. It could be family support or based therapy, where you have family interaction, as they're taking place in the therapy process. You can have cognitive or behavioral therapy, which are both good forms of therapy that can work on dealing with the patient's behavior issues, dealing with their anger issues, dealing with mental instabilities. If they have personality disorders, being able to deal with all of those type of issues that can be influencers, as far as the mental illness is concerned. And then dealing with alcohol and drug issues, if there are any alcohol or drug issues that could possibly have a strong influence already with someone who is dealing with mental illness. Then you combine alcohol or drugs, that certainly is going to increase their symptoms and increase their mental illness as well. So in conclusion, we know that mental health, as we stated earlier, it affects everyone. It just does not affect offenders. It affects everyone. And oftentimes when we're looking at offenders and when we're looking at those within the criminal justice system, oftentimes they feel left out because they have committed a crime or they have done something that has pushed them away or allowed them to be incarcerated away from society. And so as a result, many of them feel left out because a lot of times they're not getting the help that they may need, and they feel overlooked, or they feel like they're not important because they're not getting the proper drug treatment or the proper medication or getting the proper treatment that they need in these facilities. And so what happens is they end up returning back because, number one, they probably entered into the facility with some type of mental health issue, and because their issue was not treated, then they're going back out into society trying to become productive citizens, but they're going back into the same environments with the same health issues, with the same drug issues. And the problem is that they're re-entering into our society where our children are, or in our communities, and so somebody is going to be a victim of this individual who has not received proper treatment or proper mental health treatment or proper drug or alcohol, treatment, substance abuse treatment, and somebody's going to be victim to that. And so, as a result, even if there is no victim, because they have not received the proper medical treatment, a lot of times they're more prone to violence, so they're going to go out and begin to create more offenses or similar offenses to land them back within the criminal justice system. So definitely there needs to be more work that has to be done in order to ensure that yes, it can be costly for society, it can be costly for taxpayers, but when you weigh those differences out and you are allowing offenders or those who have not been properly treated for mental health issues or whatever their issues are, and in 5 or 10 years or a year or two or 10 or 15 years, they're being released back out into society. That's very dangerous. We had a case of that a few years ago where a young man, he was a sex offender from the age of 15 or 16 within our community. We all knew him. He had been incarcerated for many, many years. He got back out after about 15 years or 20 years of being incarcerated. He was still very young, maybe in his early 30s or so. And as a result, it wasn't even a month after he was released, there was a murder in our community, and he the lady, the victim, she went through such a horrible ordeal, and her body was just in such a horrible condition. So going from not having anything happening in a community that's quiet and nothing happens, and then you have this happening because the individual should have sought some type of mental health, should have been given to him going in as a sex offender, nothing was done, along with other mental health issues, and then being incarcerated for so many years around other male offenders at such a young age. So definitely there are a lot of things to consider, but mental health is so very important, because even if you're not an offender, even if you're just in a basic everyday society where you're trying to work and function, it can be very difficult if you're dealing with stressors. Maybe you don't have, maybe it wasn't, in your family. Maybe everybody in your family is fine. Maybe you've gone through some life, transition that allowed you to go through some hurdles or some things that caused you a setback in your life. And as a result, you experience severe depression, or you experience bipolar or post-traumatic stress disorder. And if those things are not treated, it can become, it can lead and become something, more where you end up doing something that you can't take back, So definitely being able to get the proper medical treatment for mental illness is so very important. And then even within our criminal justice system, because eventually these, a majority of these young men and young women are going to have to re-enter into society. And if they don't have the proper tools, or they haven't been given the proper tools, going through their treatment or going through whatever they have to go through, especially for anger issues and different things, then their next victim could be me, or it could be you, or it could be, someone in our community. So definitely being able to get them that mental health that they need before they re-enter back out into society, so they're able to function, or they have resources made available to them so that they don't end up hurting someone or doing something that they're going to regret, or just simply going out and not, being able to understand using proper judgment, or being able to know how to deal with their anger or whatever, and then finding themselves back on the inside. So you have a higher rate of recidivism taking place within our criminal justice system, and being able to find ways, to lower our prison rate, so that we are being able to have people who are in society, who are functional, who are productive in society, and being productive in their families and in their careers, and etc. So I hope that I've done something, or I've said something that is going to, add more understanding about our offenders within the criminal justice system who are battling with mental health issues, who have been diagnosed with mental health, some type of mental health issue, or maybe they're dealing with some type of substance abuse issue, and they're not seeking the proper help that they need, and they're going back out into society. We definitely want to make sure that we bring awareness that there needs to be more programs for offenders who are dealing with mental health issues or substance abuse issues. Okay, so I hope that this has been a good presentation. I'm a little nervous, and I didn't, so I was trying to do some other presentation tools, and they just were not working for me. So I decided just to do the YouTube, which is what I normally do majority of the time. So I enjoyed it so much, and I'm wishing everyone a great day.